The PRIME study is an international multi-center study looking at whether a shortened, more streamlined MRI scan called biparametric MRI without contrast is as good as a more detailed multi-parametric scan in the detection of clinically significant cancer.
And that's something which is not within the protocol yet or in the guidelines, and that's something that will change. I'm pretty sure if we can get rid of adding the contrast to the protocol, it will save costs, also will have less side effects for the patient.
I hope that we can reduce 50% of scanning time while maintaining the accuracy by not performing multi-parametric MRIs, but reducing them, replacing them with biparametric scans. No contrast, faster to read, less time on the scanner.
Are that biparametric, which means MRI without intravenous injection of contrast, is non-inferior to multiparametric MRI, where we inject the contrast in terms of detection of clinically prostate cancer. If we are going towards a pathway where we use biparametric MRI for the diagnosis of prostate cancer, then we need to be sure that we have a very high quality MRI.
The PRIME trial was an international trial, multi-center, that had 555 patients over 22 centres.
So we've demonstrated that a shorter, potentially cheaper and quicker scan is no worse or non-inferior to the current standard of care.
We've seen thus far multiple systematic reviews have been published. What we've seen there is not much difference without intravenous contrast. And what we actually see now with the PRIME study, it actually shows us a similar thing, but then in a multi-center prospective setting.
But luckily this trial has been done, and it's a very good and high quality trial, and it shows actually what we were hoping for, that they are equally in performance and that we can switch to this less invasive, less costly and much quicker procedure of the MRI, which will be of enormous benefit for everyone.
So the PRIME study is especially important to test whether a biparametric MR is as good as our standard multiparametric MR. So the PRIME study is really important, and I'm very privileged to be part of that team, and I'm looking forward to then seeing the results.
PRIME asked the question, do we need to use contrast in men having an MRI or not? And it has answered that question.